This podcast is sponsored and brought to you by HealthShare Integrated Solutions.
Dr. Mrs. Victoria Adeyemi had always dreamed of making a difference in the Nigerian healthcare system. After years of studying medicine and working tirelessly in public hospitals, she decided to establish her own private hospital. Her vision was to create a haven where patients could receive quality care without the frustrations often associated with public health facilities. Armed with her life savings and a loan from a reputable bank, Dr. Victoria founded Harmony Medical Center in the bustling city of Lagos. The hospital was a state-of-the-art facility, complete with modern equipment, a dedicated team of professionals, and a serene environment designed to put patients at ease. She poured her heart and soul into the project, determined to build an institution that would set new standards for healthcare in Nigeria. At first, Harmony Medical Center thrived. Patients flocked to the hospital, praising the excellent service and care they received. Dr. Victoria's reputation as a skilled and compassionate physician drew more people to the facility, and the hospital quickly became a beacon of hope in the community. However, as the hospital grew, so did the challenges. Dr. Victoria hired more staff to meet the increasing demand for services. Among them were accountants, administrators, and other support personnel who were supposed to help manage the hospital's operations. Unfortunately, not everyone on her team shared her vision of excellence and integrity. Unbeknownst to Dr. Victoria, some of her staff were engaged in financial misappropriation. The hospital's funds, meant for purchasing medical supplies, paying staff salaries, and maintaining the facility, were siphoned off by greedy employees seeking quick wealth. They falsified records, inflated invoices, and diverted money into their personal accounts. The corruption ran deep, involving a network of staffers who colluded to cover their tracks. Dr. Victoria began to notice signs that something was amiss. Suppliers started complaining about delayed payments despite the hospital's healthy revenue. Staff salaries were occasionally late, leading to discontent among her dedicated employees. Patients too began to feel the impact as the hospital struggled to maintain its high standards due to a lack of resources. Determined to uncover the truth, Dr. Victoria launched an internal investigation. What she discovered shattered her. The scale of the financial mismanagement was staggering. Millions of naira had been stolen, leaving the hospital on the brink of collapse. Her trusted employees, people she had believed in and invested in, had betrayed her. The revelation plunged Dr. Victoria into a deep sense of despair. She was faced with mounting debts, dwindling trust from her suppliers, and a tarnished reputation. Despite her best efforts to recover the stolen funds and hold the culprits accountable, the damage was done. Harmony Medical Center could no longer sustain its operations. Heartbroken but determined not to give up, Dr. Victoria closed the hospital's doors temporarily. She knew that rebuilding would require not just financial resources but also a complete overhaul of the hospital's management structure. She sought legal action against the perpetrators and worked tirelessly to secure new funding, vowing to learn from her mistakes. Dr. Victoria's story is one of resilience and unwavering commitment to her vision. Though she faced betrayal and setbacks, she refused to let corruption define her legacy. With time, she rebuilt Harmony Medical Center, this time with stricter controls and a team of staff who shared her values. Her journey served as a stark reminder of the challenges entrepreneurs face in Nigeria, but also as an inspiration to those who strive to create positive change despite the odds.